Okay. What's your name, sir?
My name is Nia Nguyen, and I'm from the University of California, San Diego. And my project is a meta-analysis of available data on the combo treatment that is semaglutide and sofosbuvir used for 12 weeks in post-transplant patients with genotype 1. And so, in the post-transplant setting, it's very difficult to treat these patients because they're on so many medications, and the older treatments were not as effective. And so, in a trial in a study that was by Dr. Lawitz with semaglutide and sofosbuvir in pre-transplant patients, there was very good data with this combination. And so, a lot of centers wanted to look at this treatment in a post-transplant setting to see how effective it was. And based on the available data, it looks quite good. Here is our pooled estimate of, we have here 9 studies, and the pooled estimate was 88%, which is actually a very, very good treatment effect size. And it kind of indicates or suggests that this combination is quite effective in the post-transplant setting. Because this was a meta-analysis, we didn't have a lot of safety data to do more robust analysis looking at how safe this treatment was, but just based on the abstracts and the papers that were published, it looks like it's quite effective. And the most common side effects were pretty minor, which were fatigue, headache, and just itchiness. So it looks like what the data right now suggests is that this combination is quite effective and tolerable in the post-transplant setting.
Can you talk a little bit more on your conclusions?
Sure. So here we have 9 studies, a combination of 2 fully published manuscripts, which were recently published. This is from Mayo, and this is from Miami. And we had a total of about 325 patients, and in those 325 patients, the pooled event rate was 88%, which is incredible. It looks like it's almost as good as in the pre-transplant setting, where patients don't have as much medications or are not as sick as in the post-transplant setting. And we had some data on patients with fibrosis between mild and advanced, and it looks like patients with advanced fibrosis actually still do poorly in the post-transplant setting. Their treatment effect size was about 82% compared to 95% of those with just mild fibrosis. But obviously this is a small sample, so we have to do additional studies with larger patient numbers to really confirm or corroborate these findings.
Thank you very much. Hopefully you have breakthrough